So you know that varicose vein recurrence can occur after surgery. It's reverse, and there is different mechanism, residual varicose veins and recurrent varicose veins. But now, because we use also other treatments, we use prevate. This is presence of varicose after treatment. It can be after open surgery, after thermal ablation, or after ultrasound-guided foam sclerotherapy. There is some difference between recurrence after surgery and recurrence after thermal or endovenous treatment. What we know is recurrence of varicose veins is very high after surgery, from 20 to 80%. And the main mechanism of recurrence after surgery is neovascularization, as you see here at the saphenofemoral junction here. And over time, this neovascularization can grow and be responsible of varicose vein recurrence. But one main cause of recurrence after surgery is residual GSV trunk. It can be related to a duplication of the saphenous vein trunk, like you see here, but usually it's a wrong course of the stripper that goes in a tributaries, as you see here, and the main trunk is still patent and reflexing, and this is a typical view of a residual trunk after incomplete surgery. This is a video of this residual trunk. You see it in the saphenous side, and then you see the part that has been stripped. It's fibrotic, but there is a remaining trunk. And this is another case with the trunk. It's a normal trunk, and the reflux comes from this perforating vein. This is not a remaining trunk, but a recurrent neo trunk. You see here the vein is very tortuous in the compartment, but it is very tortuous, and the reflux comes from this long and large perforating vein at the time. This is a typical recurrent trunk. It's very tortuous on B mode, on color flow. This is the failures that can be seen after thermal ablation. It's a whole study. Now we have better success, but with the technique we used 10 years ago or 5 years ago, there was some case of non-occlusion or reopening, and this is a systematization of the case of failure we can see. And usually, if there is a reopening of the trunk after thermal treatment, the reflux is not so important. And you see here a very small reopening. And we have demonstrated that even if there is a reopening, the clinical success is still here. One main cause of recurrence after thermal treatment is the incompetence of the accessory anterior saphenous vein that must be treated in the same time if you see this vein. We have varicose veins recurrence after thermal ablation with radiofrequency, even if the occlusion rate now at 5 years follow-up is 95%. After endovenous laser, there is also varicose recurrence from 14 to 40% of the cases. But one more time, if there is recognition, only 10% of this recognition are clinically relevant and necessary complementary treatment. This is a study from Marianne de Besner, which is very involved in varicose recurrence after surgery. And this is his experience of this center, and you see that until 2005 they do a lot of redo surgery, and now they treat recurrence with intravenous treatment, and especially foam. This is a study demonstrating the effect of ultrasound-guided foam sclerotherapy for the treatment of varicose veins. And you see that in this retrospective study, they obtain a reiteration success rate of 58% in one session, but at the end, almost 90%, with few complications. This study is also about recurrence, and you see that the success rate is around 75%, and it's the same if we treated primary or recurrent varicose veins. There is no difference. This is another study evaluating ultrasound-guided foam sclerotherapy for recurrent veins. And here, the obliteration success rate is 90%, with very few recognition. And if recognition occur, one complementary session of ultrasound-guided foam sclerotherapy is successful. This is a recommendation of Michel Perrin about small saphenous vein recurrence, and usually he recommends to use ultrasound-guided foam sclerotherapy for this treatment. We can also use thermal ablation with a very high rate of success, almost 98%. And it's the same success for primary and for recurrent varicose veins. This is a comparison of surgery and radiofrequency for the treatment of recurrent varicose veins, and you see that we have always the advantage of endovenous thermal treatment with a quicker treatment and less pain. And this is what we obtain with laser, endovenous laser, and it's the same with a very effective technique and few complications compared to surgery for the greater saphenous vein treatment and for the small saphenous vein treatment as well. But finally, there is cases in which there is a rectilinear trunk that be treated with ultrasound-guided foam sclerotherapy or with thermal treatment. But there is cases where the recurrent varicose veins are very tortuous, and thermal ablation is ineffective, and surgery is very difficult to achieve. So there is a situation where, in case of residual trunk, we can use chemical or thermal ablation. But in case of neovascularization, that's sure that ultrasound-guided foam sclerotherapy is the only technique suitable to treat these small veins, and it's quite easy to achieve. You see here before and after treatment the complete occlusion of these small veins that are very difficult to treat with a surgical procedure. And it's the same, of course, for neotron. This vein is very tortuous, and ultrasound-guided foam sclerotherapy is the only technique available to treat this kind of veins. So finally, to answer the question, I would say yes, it is in a large majority of cases. Thank you very much.